members, ladies and gentlemen. Mr. Davids, do we have the AG and the audit committee in?
Good afternoon, Chairperson, members. Yes, Chairperson, we have the Audit General in, Chairperson, as well as the Chairperson of the Audit Committee, Mr. Amin Ahmad.
No, that's fine then. Excellent. That's fine. Then let's just wait for the top of the hour, and then we can start then soon. Good afternoon, honorable members, ladies and gentlemen. It has just gone 2 o'clock, and I would like us to start the committee meeting. As been indicated by Mr. Davids that we have the Auditor General as well as the Audit Committee in the meeting. In order for us to start, before we may start, can I just get an indication of honorable members that are present in the meeting?
Good afternoon, Chairperson Matlodi Maseko in the meeting.
Thank you very much, honorable member.
Greetings, Chairperson in the meeting. It's Member Makamba Boja on behalf of Melika Yapweko. Thank you.
Thank you very much, honorable member.
Good afternoon, Chairperson Gillian Postman, standing in for Member Derek America.
Thank you very much, honorable member. Thank you very much. Then it looks like there are no further members that are available at the present moment. And then those maybe that will join us later, they will get us in motion. Then honorable member, let me just ask Mr. Davids, whether are there any indications of apologies other than those members that have indicated that they will be represented by their alternative members?
Chairperson, good afternoon. No, Chairperson. As indicated, it was just Member Bartman that indicated this morning she won't be in the meeting. Member Klejo and Member Bosman just indicated he's standing in for Member America.
Thank you very much. Then, honorable members, let me make use of this opportunity of welcoming you to the Standing Committee of the Public Accounts Committee of the Western Cape Provincial Parliament for purposes of looking into the annual report of the Department of Social Development. The meeting is going to be held in 2 parts. The first meeting is going to be an in-committee meeting, which means that no members of the public are allowed. Only those members of the committee and other members of the provincial legislature, together with the audit committee and the Auditor General. This first part of the meeting is for purposes of getting a briefing from the Auditor General and from the Audit Committee on the audit outcomes of the department. After members have actually asked point of clarity and question and have engaged with the briefings, we will therefore move on to the second part of the meeting, which will be an open meeting where we will be joined by the department. Order for us to start, can I get an indication, Mr. David, whether has the meeting been closed from the public?
Chairperson, I've just requested IT to close the meeting, Chairperson. I'm just waiting on confirmation from Mr. Clare.
Mr. Davids, is the minister and the HOD in?
Good afternoon, Chairperson. Yes, I've seen the Minister. There is the Honourable Minister, Chair.
Welcome, welcome,
Beautiful as
Minister.
ever.
Greeting and welcome, Minister. Okay. I think let us then get started. Honorable members, let us get started then with our second part of the meeting. Mr. David.
Chairperson, I do not see the HOD Dr. McDonald in the meeting, Chair. I'm just going to email him quickly, Chair, with a link just to request that he join in via the link, Chair.
Okay, that's fine. Just indicate then as soon as he is in.
Chairperson, the HOD indicated he's busy logging in now. Chairperson, the Honourable Minister and Dr. Robert McDonald, the HOD, is in the meeting, Chair. Thank you.
Thank you very much. Then we are set to resume our meeting, which is the second part of the meeting of the Standing Committee on Public Accounts of the Provincial Parliament of the Western Cape for purposes of considering the annual report of the Department of Social Development. Let me make use of the opportunity to welcome the department led by its political head, the minister, and also the HOD, which is the administrative head of the department. Welcome, Minister, and welcome, HOD. Welcome to the rest of your team. As I've indicated, this is the meeting of the Standing Committee on Public Account for purposes of looking into the annual report of your department. The meeting is an open meeting. That means it is open to after the members have actually engaged the department and finish engaging, the department will allow those members of the public who are part of the meeting and who have indicated that they would like to ask questions or like to make comments or point of clarity on the report. So what I will do then now, honorable members, I want to check whether are there any opening remarks that the minister would like to make.
Good afternoon, Chairperson. Yes, I would like to avail the opportunity. Thank you. To the Honourable Chairperson of the Standing Committee, the Honourable Committee members, the team from the Auditor General, the Audit Committee led by Mr. Ahmed, who I think is in his last session as he goes off at the end of the year, to all other officials on this call, but especially to HOD McDonald and the team from DSD. Thank you for the opportunity to present our annual report for scrutiny. We have done the first component of the report this morning, and we're going to be focusing on, I think it is section C and E, which is governance and financial matters in this section. Honourable Chairperson, for me, what is key, and I will reiterate what I said this morning, that we have never experienced a reporting period like the last reporting period that we are talking about. We never anticipated that COVID would have the impact that it did. Our APPs were not aligned with COVID. And so as I closed the session this morning, I said there is a lot of work that has been done that is not reflected in the annual report because they were not part of our original APPs when we went through that exercise. So I want to talk about the deepening impact of COVID, which has resulted in increased poverty and unemployment, and the needs of the department to respond swiftly and to be responsive to community needs. So we have sort of morphed from a siloed mentality of working in departments to transversal working groups. And this department was very involved in the humanitarian work stream. And now with the recovery plan of the Western Cape government, HOD MacDonald convenes the meeting and I lead the well-being and dignity work stream. And a lot of the work that we do is actually not covered in this. But my concerns, having read the entire report and worked through it, and also understanding the challenges that Team Finance had, I am, and I do want to express my concern, I am concerned about the interpretation of the legislation and the way it gets applied. I am concerned about the amount of red tape that is spent on this exercise, and also the amount of time that the AG actually spends in any specific department. And I really would want to see us, because COVID requires us to think differently and to do things differently and to try and deliver services as efficiently and as swiftly as possible. And I fear that if we are going to view the audit report as a tick box exercise, but rather see it as a mechanism in terms of a response to a global pandemic, that piece is missing for me. And I really would want to see some work being done in that space. And I also want to commit that my team and I will support and work and collaborate with the AG and the audit committee, which we have always enjoyed good relationships with. However, I think this last experience was a little bit taxing. We saw 3 extensions. I had to write letters to Parliament requesting extensions, and I can understand that there was work to be done. There were COMEFs, there were all sorts of things. But I really do think we need to sit down and co-create the future so that we can first and foremost address the needs of the most vulnerable in the quickest, easiest manner possible without getting caught up in technicalities. Because when you have to account and you have members of the public questioning you, they do not understand that we have all these processes, all the hoops that we need to jump. And I definitely support good governance. I support the need, coming from 30 years in banking, I understand the need for governance and control mechanisms, but I really do think that it would augur well if we could navigate a way beyond what has transpired in this last round of reporting. On that note, Chairperson, I just want to say thank you for the opportunity. The team are here to talk to whatever issues may arise. And as I said, we remain committed, but there is a lot of work that has been done that is not reflected in this report. And I think we do need to take cognizance of that. Thank you, Chairperson.
Thank you very much, Honourable Minister. HOD.
Thank you very much, Chairperson, and also like to say thank you to the Minister for the introductory comments, and then also thank you to the members of the Standing Committee for affording us the opportunity to come and answer questions today. I think the Minister's covered most of the additional observations from the department side, other than to say that I think we, realistically speaking, we have had a very difficult year where we've had to very rapidly adjust to the realities of the disaster situation that we were presented with. Social development in particular had to move very quickly during a period early in the financial year where lockdowns were put in place at very short notice, and which the traditional or the core service provider for social relief, being SASA, was in a process of trying to get their systems ready to provide COVID support, and during that period where there was a gap, we had to come very quickly to the party with food relief to try and assist people who had been limited to being at home by the COVID regulations. So governance unfortunately took a back seat during this time, and it does reflect somewhat in the report that you would have seen. There are some areas of governance that had to wait, or that were not as tight as we would normally want them to be, because everyone had to basically get themselves into a new set of processes so that we could respond and shift away from all of our planned activities to providing humanitarian relief. So it was a very disruptive year for governance, very disruptive year for administration, and we also had to adapt to remote working requirements as well very rapidly, and then also secure essential services and make sure that there was business continuity through the disaster period. So a lot of the planned governance activities, as well as a lot of compliance issues, were not able to be kept to the level we'd normally keep them to, and we would see that in some of the reporting that's coming through from the Auditor General. So I think we know that there's a lot of work to be done to catch up on the governance front, and I think that would be reflected in the audit reports as well as the inputs from the audit committee. But we do now have the time to do that. We didn't so much have the time during the disaster, the thick of the disaster. But I think also that under the circumstances, we were still able to come through with a reasonable level of assurance in terms of compliance and accounting, and that I think the team did very well under the circumstances, under very unstable conditions and challenging conditions, as we've seen in our fellow departments across the province. I think it was very difficult to keep it together. And we also managed to continue funding NGOs through the period. We were the only province that managed to actually do that, which I think speaks volumes of the commitment of the administrative team to being here and making sure that funds were reaching the NGOs that needed it during this time. And I'd like to thank them very much for their dedication and effort during this time. Thank you very much, Chair.
Thank you very much, HOD. Honorable members, I'm now going to afford an opportunity for the honorable members who would like to engage with the report or would like to ask questions. For your information, honorable members, we are now dealing with the annual report as in section C as well as section E of the report. Can I get an indication of honorable members who would like to ask questions? I see Honorable Bakubaku, Honorable Boja. Can you go then, honorable members, in the meantime, in that order? Honorable Bakubaku.
Thank you, Chair. Can you hear me?
Yes, Honorable Bakubaku.
Chairperson, first of all, I would like to
You've
I
got
would
an-
like to commend the department, including the minister, for their hard work. I know social development is a very difficult department because they have to carry the whole Western Cape in their shoulders. Remember, people are vulnerable out there, and Department of Social Development have many tasks that they must fulfill. And so far, I just want to say to them, they must just keep it up and be strong. And I appreciate the fact that they are not using their political powers or whatsoever in the department, but they are serving our society at large, as we expect them to fulfill the task that they are given. But I also want to go to 116, the third bullet, in the ineffective NPO management contracts. I want to ask the following question. How prevalent is this issue in the department, and are the strategies to address the issue of non-compliance among NPOs in the department? What measures are in place to mitigate the risk of safety of staff? Still, in page 116, on the fourth paragraph, I would like to ask the following question. Can the department provide the committee with minutes of the ERMCO meetings and the mitigation factors that were agreed upon? In page 116 again, in paragraph 5, ERMCO discussed the risk of disruption to services due to COVID-19 and what mitigation strategies were put in place. And my last question, Chairperson, is in 117. The key emerging risk which needs to be considered in the next financial year relates to the department's ability to deal with the increased food insecurities in many communities within the Western Cape, mainly due to the COVID-19 pandemic. I want to ask the department what mitigation measures are put in place to address risk, and what measures are in place to support community and households in gardens. And the last question, young Chairperson, is on 118. Can they provide more details regarding the 3 cases where the employees involved in dismissal, and what are the profiles of the 3 staff members? Thank you, Chairperson.
Honorable Pochat and Honorable Barnes and Honorable Van Vogel.
Can you hear me, Chairperson?
Is it Honorable Pocha?
Chairperson, can I speak?
Yes.
Can you hear me, Chairperson?
Is it Honorable Pocha speaking?
No, Honorable Bagbak.
Oh, ndicinobuqobile. Sivile. Obusaqhubekeka.
Iqabile, Chair.
Okay, thank you very much, Honorable Baku. Thank you. Honorable Boja.
Nkosi Mhlali ngaphambili. I've got 4 questions. Two questions are coming from Part C of the report on page 118, where the nature of 3 cases outlined there are very serious. And I can see that the cases have since been closed. But what I want to know is whether those 3 employees are still employed by the department. So that's number 1. And then on page 127, I want to know what caused the under expenditure of 65,000 rand, which with regards to goods and services, and how does the department account for that? And then on part E, on page
Honorable Boja,
Yes.
Boja, sorry, we're just dealing with C now.
Okay, Chairperson, those are my 2 questions on part C. Thank you, Chair.
No, thank you. Okay, then Honorable Barnes.
Thank you, Chairperson. My first question will be on page 120 under health and safety environmental issues. The topic that speaks on the health and safety risks within the department, varying from offices and facilities incidents to more complex occupational hazards, such as physical injuries. My question, Chair, there is, what measures were put in place to mitigate this risk in old age homes? Second to that, what is the number of elderly persons in old age homes and staff that have vaccinated? Lastly, Chair, what is the number of the department's employees that have vaccinated? My second question, Chair, will be on page 122, the first row, a copy of the staffing assessment report and the request for additional staff for the West Coast region submitted to the DSD head office in 2018. Can the department provide an update regarding the staff challenges at the West Coast and DSG Morrisburg office? My third question is on page 129, Chair, under bullet 9, performing an investigation on payments not made within 30 days. What is the number of invoices that were not paid within 30 days and the reasons thereof, Chair? On page 132, under compliance, Chair, the audit committee has reviewed the department's processes for compliance within legal and regulatory provisions. What I want to know, Chair, is that did this include compliance challenges or funded NPOs, or if the department can just elaborate on that? My last question, Chair, is on page 133, the last sentence. The audit committee also notes the increase in findings raised by the external auditors resulting from differences in interpretations of National Treasury instructions and circulars. Can the department provide more clarity on these findings that were raised? I thank you, Chair.
Thank you very much, Honorable Barnes. Honorable Van Vogel.
Thank you, Chairperson. Chair, am I honorable?
Yes, Honorable Lula.
Okay, thank you so much, Chair. Chair, mine is on page 118, paragraph 3. What is the number of employees that obtain approval to perform other remunerative jobs outside the public service? And then second to that, are there any employees that perform remunerative work without approval? Then my last question, Chair, is on page 119, paragraph under point C. Point of reference, identify cases of employees who appear on the central supplier database. Address with relevant employees, requesting them to exercise their decisions as contemplated in transitional measures above, and to provide the department with the necessary documentary evidence of their decisions. So my question to that is, what is the number of employees that appear on the central supplier database, and how many obtain approval for it? Thank you so much, Chair.
Thank you, Honorable Lulama Van Vogel and Honorable Maseko.
Thank you very much, Chairperson. Chair, I just want to start by really congratulating the department for the sterling work that they did throughout. It has been a rough year, and especially for this department because they had to carry responsibilities of the well-being of a lot of families in making sure that they can sustain and try to be as normal as they could be. And above that, in having together clean audit, it is a plus for where they were not even prepared to where they're going to mitigate to make sure that their services are being delivered throughout the province. So Minister, HOD and the department, I just want to say I salute you for everything that we've been doing in our communities. Just a quick question to Minister is, the GBV didn't stop, and with the lockdown, more was happening. So I want to find out to what an extent in trying to mitigate or relieving the families on the COVID-19, giving the services, and also trying to make sure that the GBV numbers are going down. What were the difficulties in accessibilities to their communities? Because I believe that the accessibility in the lockdown was difficult, and in trying to make sure that we can access to help and also communicate the relief within different communities was one of the challenges as the public reps, as we were trying to also take our responsibility in assisting in the communities. So what is it that the department has become innovative in dealing with that can maybe today we can hear how did they go about, and how would in the way forward try to mitigate and budget to make sure that the sustainability, if the numbers have gone down, of course, in the province, but if they've gone high, what is it that they feel has to be done to make sure that we can spread and try to deal with that issue within our communities? Thank you, Chair.
Thank you, Honorable Maseko. Can we hand over to the department to respond?
Thank you very much, Chairperson. In terms of the articulation of risks and the mitigation of them, Honourable Member Baku Force raised the question of how prevalent the issue is of NPO non-compliance, and the question of ineffective NPO contract management, I think was something that we came into focus, particularly in the lockdown period, because we were, for a while, we had to stand back from doing site visits to NGOs for compliance monitoring. And so it was a slightly escalated risk in that sense, although now we've been able to start resuming those things. There has been some steps put in place during the lockdown period to ask the NGOs to submit sometimes documentary evidence by WhatsApp or with photos and so on, to try and mitigate the fact that we can't be on site during the level 4 and 5 particularly lockdowns. But we did see still a fair level of non-compliance of NPOs in the departments, and unfortunately there were some, particularly in the ECD sector, that were actually had to close down because they couldn't sustain themselves when they were ordered to close. Even though the department was funding them, they didn't. They also needed funding from fee-paying parents who were not attending. So there was quite a high prevalence of NPO non-compliance in the ECD sector in particular, but also other forms of non-compliance were, for example, where organisations' registrations lapsed, or where organisations were not able to meet the norms and standards required for the service. But those instances, we usually try to assist the organizations to correct the situation before we go the route of terminating funding. And also because we know that there will be a gap in services in the community if we close the organization down or stop funding them too quickly. So we do try to work with the organizations and assist them to become compliant, and also we do have our NGO support unit in the department that does assist the NGOs as well with governance skills and helping them to be able to comply with all of those aspects. But I think also there are some organizations that also don't use the funds for intended purposes, and there we have to take a fairly hard line, because then we face the risk of funds being stolen and so on. But fortunately there were not many cases like that during the year. In fact, we didn't get any new referrals to Provincial Forensic Services for investigation during the year under review. There were no reports of serious abuse of our funds, so we were able to avoid that kind of situation by and large. The question around the minutes of our OMCO meetings, I'm sure we can provide the committee with copies of those minutes for their further perusal. Also, the question around the risks of disruption to services due to COVID and what strategies were put in place. I think we can speak in great detail about what had to be done to ensure that we could implement remote working arrangements for our personnel, both on the administrative front, where we had to decentralize access to the BAS and LOGOS systems so that payment runs could continue for NGOs, for service providers and contracted services, and also for the payment of personnel. And then on the other hand as well, remote working arrangements for frontline service delivery staff. So where possible, we began to introduce various kinds of telephonic and virtual link-up between social workers and their clients where possible, so that they only did direct contact with persons or with their clients where they absolutely needed to. The courts also adopted some of those strategies as well, which helped us work remotely during the time. And then also in terms of our workplace and safety, which was also a question that came up later, the department also provided transport to people who needed, our personnel who needed to work in the facilities, and also to personnel who would normally have to take public transport. So we helped our staff by taking them away from public transport, and they were then able to travel safely to work using the government garage vehicles during the hard lockdown periods. There was also extensive provision of PPE and all kinds of other forms of safety gear provided to personnel, as well as fogging of the offices with sanitizer and the provision of large quantities of sanitizer to personnel. So that way we were able to mitigate some of the disruptive effect of COVID on the services, but there were some services that we couldn't avoid having disruption, particularly where it involved group work or congregations of people, which were prohibited during the higher lockdown levels. Those services then had to be delayed to a later part of the year when they could resume having those group settings. I think also we know the ECDs were disrupted. They were closed by a direction of the national minister, so that was unfortunately disrupted. So there were some forms of disruption that we couldn't avoid, but we were able to sustain most of the essential services for that period, and I think that worked reasonably well. We were able to ensure that the most important cases were dealt with in the child protection system, in the GBV system, and for older persons and so on. In terms of the question from Member Baku Foss about the ability to deal with food security in communities. I think the primary measures that we put in place as social development was the distribution of food relief that started with food parcels, which is not the most efficient way, but it was the quickest way to do it at the time that the lockdown was initially declared. So the distribution of food parcels was the first measure, and then also we increased our allocations of funding to the community kitchens, or rather the community nutrition and development centres, or CNDCs, and also increased our allocations to the targeted feeding sites. And then we also gave the green light for the ECDs to continue providing food to the children that would normally attend on a takeaway basis, so that those children still obtained daily nutrition from the ECDs, even though they couldn't attend the ECDs, but they could collect their food. We also work closely with the Education Department in terms of the coordination of food relief. The Education Department reinstated the school feeding scheme long before the schools reopened, which also ensured that the learners who normally get food at schools were still able to access some nutrition. And then later into the lockdown, SASSA then was able to bring its COVID relief package on board. And SASSA, of course, is the primary provider of social relief, distress and safe social safety nets in the country in terms of the Social Assistance Act. And they brought much larger amounts of funding into the space through the COVID grant. So we were able then to work alongside SASSA to make sure that we could mitigate food insecurity. In addition to that, we did also have the Solidarity Fund rolling out food relief, which we coordinated with them as well, so that we didn't duplicate. And we also had private donors providing huge amounts of support through various community kitchens and NGOs independently of the department, although we did also receive a lot of donations which are duly disclosed in the annual report, which we also then distributed. In addition to that, there was also the farmers and the Department of Agriculture providing support through food gardens, and also delivering produce that couldn't be exported due to the lockdown, that was then rerouted to provide support to communities. There are also other forms of support as well, like the EPWP program. Increases were allocated to EPWP workers, and more people were brought into the EPWP program to spread income. And then we had food vouchers and the distribution of food ingredients to informal community kitchens, which wouldn't normally be able to be funded by the department, but we did provide them with food ingredients so that they could distribute it and cook it in communities. So those kind of things will continue, but the Department of Agriculture is also working on the implementation of a Nourish to Flourish strategy, which is a shift towards food security and sustainable food security. So while we continue with our food relief, the Department of Agriculture is driving the rollout of community kitchens, of community gardens rather, as well as of home residential gardens and other forms of sustainable community-based nutrition. So it's that plan, in a sense, is a more long-term approach to try and strengthen the resilience and food security in the province. The question from Member Baku Foss about the 3 provincial forensic services cases, which were closed at the beginning of the financial year. The 3 cases are firstly a allegation of corruption at one of the child and youth care centres among the staff at the centre. It was a tip-off, hotline tip-off. Another matter was alleged fraudulent use of funding at a funded organisation. And the third was also an NPO alleged misappropriation of funds at an NGO. That was the nature of the matter. In terms of the outcome of those investigations, the first of those three involving the allegations of fraud or corruption at an NGO where the funds were misappropriated, that has been handed over to the Hawks for their further intervention. The second matter relating to fraud and theft at an NGO has also been handed over to the Hout Bay Police, and the case number was issued there. And then thirdly, the alleged corruption at the department's Child and Youth Care Centre. The finding was that it wasn't actually corruption, but there was a irregularity that needed to be addressed through corrective measures, which has been implemented. So in more detail, the alleged corruption was related to a former service provider to the department known as BSASA, where it was alleged in the BSASA hearings in the State Capture Commission, the Zondo Commission, that there were two DSD officials who allegedly received gratuity from BSASA while employed at social development. There was no actual evidence of their involvement or influence in the management of the BSASA contract at social development at the time, which goes back many years. So it was quite difficult to find much evidence or detail, because the case, I think, goes back to somewhere in the region of 2012. However, there was confirmation that the two officials in question did receive some benefits from BSASA, and therefore and didn't declare it, and therefore it acted in contravention of the requirements to disclose gifts and donations. But the fact of the matter was that there was no evidence of actual corruption or wrongdoing in exchange for those gifts, although it can be inferred that there was certainly a conflict of interest. In terms of the one of the allegations related to organisation in Hout Bay, there was confirmation of theft, as also is the case with the second organisation that was mentioned. So those two matters are with the law enforcement authorities. There has also been a report handed to the Zondo Commission of Inquiry on the outcome of our forensic investigation into the BSASA, the officials involved with BSASA. Then returning to the question from Honourable Member Botcha about the employees involved in the BSASA matter, the response is no. The employees are not still employed at social development. They both left the department, I think in 2014 or thereabouts, or before then. I don't have the exact date, but it was somewhere in the region of 2014 that those officials both left the department. The question regarding the underspend of 160,000 Rand, I will ask the CFO just to speak briefly to that.
Thank you, Judy, and through you, Chairperson. The 65,000 Rand relates to private telephone calls. In this case, because we're working from home, there obviously has been under collection, because normally when staff use their telephones at the office and they do private calls, they need to then repay for those private calls. So in this case, there has been an under collection due to most of the staff working from home. Thank you, Chair.
Thank you very much, CFO. And then on the question from Honourable Member Barnes on the health and safety risk, what measures to mitigate were put in to mitigate risks at old age homes, I think I've already spoken to some extent on the efforts of the department to address the health and safety risk for departmental employees. In the old age homes, the department doesn't run any old age homes, but we fund old age homes, and we allocated funding to the old age homes to assist them with obtaining the necessary PPE, so that the staff and residents in the homes could use that PPE. We also rolled that out to disabled homes as well, and also child and youth care centres. In addition to that, obviously the old age homes were right in the front of the queue for vaccinations, along with the Department of Health staff. And so the residents in the old age homes and staff were vaccinated very early on in the vaccination rollout process. So that they were well covered, and there's currently only one case of COVID in the old age homes among a staff member, I think it is, across the province. So we've got a very low risk at the moment, thankfully, due to quite an extensive rollout of the vaccinations in the homes. The next question from Honourable Member Barnes about the number of social development personnel. Sorry, I left out the number of vaccinated persons in the old age homes. We vaccinated a total of 20,957 older persons and 11,432 staff members in the old age homes. In the department itself, our own personnel, we have vaccinated a total of 1,438. We have a total of 1,438 staff in our department who have been vaccinated that we have a record of. However, there may be others who have been vaccinated independently who haven't informed us, so it may be a higher number than that, but that's the number we have who've confirmed that they are vaccinated among our personnel is social development, and that's out of a total staff workforce of 2,544. So it's about a 56% of our personnel have confirmed that they're vaccinated, but as I say, we don't know for sure how many more have been vaccinated who haven't informed the department. It could be quite a lot more at this point. In terms of the staffing reports and the challenges raised in the report of 2018, and the request for a copy of that, I'm sure we can provide a report, the copy of that report, but I will ask Ms. Van Rieenen maybe to provide an update on the West Coast issues that are identified in there, particularly around Mariatsburg. If Ms. Van Rieenen can just speak to that.
Thank you, HOD. The vacancies are filled currently, and subsequent to after the filling of the vacancies, we've lost 2 staff members there, but we have added some graduates to assist with the service delivery issues. So there's currently the workforce issue has been resolved actually.
Thank you very much, Ms. Van Rieenen. Then on the question of the 30-day payments, I will ask the CFO just to speak briefly to the number of payments outside 30 days and the reasons.
Thank you, HOD, through your chair. First of all, we deal with about 47,000 batches, payment batches. Of that, there were the 6 invoices in those batches that were paid after 30 days. And the reasons for that is in 3 of those invoices, there were systems errors. In other words, when we do the processing and we account a message on the system, then we need to refer that to National Treasury for them to clear it before we can go further. Sometimes it takes a few days before we can do that, and then we run over the 30 days in that case. There was another case, an invoice where a person, staff member, was non-compliant. and that person has been disciplined. And then 2 other invoices was due to the fact that staff had to vacate the office due to a positive case that emerged, and they had to clear the offices, and the time that it took for them to return to the office, they could then not pay those within 30 days. So those are the 6 invoices and the reasons. Thank you, Chair.
Thank you very much, CFO. And then on to the question from Honourable Member Barnes about the question around the Audit Committee's review of compliance and whether this included compliance of funded NGOs. No, that is a different process. So the Audit Committee's review of compliance looks at the department's compliance with laws and regulations. The compliance monitoring of NGOs is something that our department does through its program offices. Each of our program offices, whether it's the Children and Families Program Office, the ECD Program Office, the Disabilities Program, or the Older Persons Program, etc., they all have a team of monitoring officials who look at the quarterly reports of the NGOs and the financial statements that are submitted annually to do compliance checks on there, and then also they do go out and do physical checks. Although, as I mentioned earlier, that was delayed during the hard lockdown periods due to the need to avoid unnecessary visiting of sites, but that has resumed now. And the compliance monitoring by the department is then used to flag any NGOs that are non-compliant. The Auditor General does also go out to the NGOs to do checks on the performance, the integrity of the performance information. So they do checks on the quality of the performance information, but that's part of the AOPO audit and not the compliance of NGOs with terms of contract. That's something we have to do. The question from Honourable Member Barnes about the increase in findings by the Auditor General on interpretation of National Treasury regulations. This is something that specifically is flagged by the Auditor General in relation to the correction of misstatements in the financials, and in particular, there were some items where the department had utilised funding as goods and services funding to NGOs, which the Auditor General took the view that it should have actually been used in the goods and services funding, because of the way that the funding was allocated in terms of the contracts that were set up. So the Auditor General found that in their view, the departments had funded organisations in a way that instructed them to do certain things, particularly around the food distribution, that was more of a nature that could be interpreted as being a service provider rather than a recipient of transfer funding. And for that reason, the Auditor General felt that we had used funding not in compliance with transfer funding guidelines as issued by National Treasury, but more in line with a goods and services approach, which would then was a compliance issue because the funding should have been disclosed as goods and services and used accordingly. So for the Auditor General, the findings were that we were not compliant with National Treasury guidelines and instructions around transfer funding. And we consulted the Legal Services Department of the Department of the Premier to guide us on that as well, because we were uncertain about it. It was quite a complex issue. The Legal Services Department came back to us and said that there's that it could be interpreted that way, and so we then made some adjustments to the financials to reflect the corrected interpretation or the corrected classification. It is very difficult because the National Treasury guidelines around the difference between goods and services and transfers are in some ways quite open to interpretation. They're quite difficult to sometimes make a call on. In particular, one of the key characteristics of transfer funding is that it should be transferred to an organization, but not it should not be requited. In other words, it should not benefit the department. And our interpretation thus far has meant that we can't use transfer funds for goods or services for the department's benefit, such as, for example, training of staff in the department, or the provision of government garage vehicles for the department, or cleaning services for the department, and so forth. However, the Auditor General and the legal services tended to agree with them on this. Was of the view that if an organisation is funded in a way that furthers the objectives of the department, it can also be seen as a form of requited funding, because it helps the department meet its objectives. So it's a very fine line, because of course we also shouldn't be funding organizations if they don't align with our department's objectives, but it's down to the way that the contracts are worded, because the contracts are fairly instructive in terms of what the NGO needs to do, to the point where it does start to read more as an agent of the department or something of that nature. So I think that is the essence of the difficulty we ran into with the goods and services versus transfers interpretation, and we agreed with the Auditor General, but we did also flag the fact that there's ambiguity in the system, and that it is very difficult, and it does make the officials very risk averse when interpretation can have such a profound impact on how the audit outcomes go. So I think we noted the need to change our approach, but we are working closely with legal services now with our contracts going forward to try and make sure that we can steer clear of this kind of issue again. In terms of Honourable Member Windvogel's question about the number of employees who have received approval for remunerative work outside of the public service, we have a total of 54 approved employees at this point. And the question about whether any employees identified doing RWOPs without approval, I will ask Ms. van Reenen just to indicate whether we have had any cases of that nature, but it's not many. But I'll ask Ms. van Reenen if she can just indicate.
None, HOD.
Thanks very much, Ms. van Reenen. I think there might have been a case last year, but not in the year under review.
You're correct, HOD.
Thanks, Ms. van Reenen. And then can you also assist with the question about the staff identified who are appearing on the Central Supply Database, which we dealt with in response to the Public Service Commission?
HOD, none that I'm aware of, unless CFO knows that some that they pick up through the procurement process, but none that I'm aware of.
Thank you, Ms. van Reenen. CFO, have you picked up any of those?
Actually, through you, Chairperson, my understanding of the question was that should employees be also doing business or are conducting business with as a director of a company, that such employees should resign, and then we can follow that up through the Central Supply Database. So whenever they do any transactions with the department, the Central Supply Database will indicate that, and then we will then take that forward and ensure that the employees do the necessary. So in our case, that is a preventative mechanism that we have in place. So is none that I can also recall of employees that's on the Central Supply Database that we deal with at this stage. Thank you.
Thank you, CFO. I think also we have received a list of names of employees from the Public Service Commission who they picked up are involved in companies that do business with the state. However, when we followed it up with the officials, we found that many, I think all of them, had actually resigned some years ago from those companies, and that their names still appeared on the database. So there's an issue with the database not being updated, and so there are some employees' names who still sit on these boards or as owners of companies when in fact they have resigned some time ago. So when we get those letters from the Public Service Commission, we then check with the employees, and they provide us with the evidence of that they've left the companies, and then we then revert to the Public Service Commission. But there seems to be a lag in the national database in removing people's names who used to be in companies that are no longer in those companies. And some of the companies also dormant or have actually closed completely. They're still sitting on the database as well. And then in terms of the question from the Honourable Member Maseku, what were the difficulties in terms of accessing communities for GBV services during the lockdown? I think the primary challenge with all of our social work services was being able to make direct contact with the clients during the lockdown period. Courts were also closed periodically due to COVID infections. And the courts had also taken an approach that they're only going to deal with very urgent matters. So there were some cases that got put on the back burner during the lockdown period at the courts. The department has actually has tried to mitigate some of this by putting in place measures such as we provided taxi services to victims of GBV who needed to move urgently to safe spaces, and then they could quarantine in a separate section before entering those shelters. We also have set up 6 new shelters in rural areas during the year under review, which were made available by the National Department of Transport and or rather the National Department of Public Works and Infrastructure, and we've arranged to fund NGOs to look after those centres and assist victims of GBV in those centres. So we've managed to expand our footprint quite well to reach more communities, particularly in the rural areas. But also, I think the provision of the necessary tools to our personnel and vehicles and so on to be able to reach out into communities did assist to a large extent. But during level 5 and 4 lockdown, general access generally was quite challenging, and also the number of reported cases of GBV came right down during level 4 and 5 lockdown. Since the affected victims were not coming forward to the police stations or to the Tutuzela centres due to the restrictions on movement. So the GBV cases then started to show up only a little later into the COVID disaster period when the lockdown measures eased somewhat, and then they started coming forward to the SAPs and to the Tutuzela centres for assistance. So we then saw a sharp increase in GBV cases in the second half of the financial year under review, and by that time our ability to respond was also improved because the access became a little bit easier under level 3. So I think it's an area of ongoing development. We've expanded quite significantly in the last 2 years in terms of GBV services and the accessibility of those services, but there's still a need to continue expanding further, and that's why we've worked on the Western Cape transversal implementation plan for the National Strategic Plan on GBV, which sets out some of the things that our department needs to do, as well as other departments such as health and community safety and so forth. I think also we've started integrating our GBV response with the rollout of the safety plan in the province, with the targets specifically targeting the high-risk areas, the murder hotspots that are the subject of the safety plan because of the high murder rates are also the GBV hotspots of the province. So we need to tackle crime in those areas holistically, and social development is part of the teams that are working in those areas. We are part of what is called the social crime prevention aspect or work stream of the safety plan. And GBV, substance abuse and child protection services are a critically important part of the safety plan as it's envisaged now. So I think those are the questions posed. Thank you very much, Chair.
Thank you very much, HOD. Honorable members, do you have any other follow-up questions? If there are no follow-up questions, can we move to section E? I see the previous hands that were up are still up. Is that an indication that members would like to ask in that order in E? Because I see Honorable Boyka, Honorable Barnes, and Honorable Vensvogel's hand is still up.
And Honorable Bakufos, we are using the same gadget, Chair.
So, like, it looked like now we've got Honorable Barnes, Honorable Bakubaku, and Honorable Vensvogel. Okay.
Chair, Solomon, to interject, I'm not sure. Are you now taking hands for Part E, or are you just verifying if it's old hands?
Yeah. So I'm taking hands for Part E, but I was seeing that the old hands were still up.
Okay, my hand is up, Chairperson.
For E, ne?
Yes.
Okay, so let's do it in this order. Honorable Barnes, then Honorable Bakubaku, Honorable Vensvogel, and Honorable Boyka. I see Honorable America's hand is up. Okay, let's do it in that order, honorable members.
Thank you, Chair. My questions are on page 191, under the table of minor assets. What caused the increase on the expenditure for minor assets, and what assets were procured? My second question is still on page 191, Chair, under the table of agency and support outsourced services. What are the reasons for the high increase on expenditure for agency and support outsourced services? Or again on page 191, Chair, under table consumable supplies. What are the reasons for increase on expenditure for consumable supplies? My last question, Chair, on the same page will be under property payments. What are the reasons for the increase on property payments? I thank you, Chair. That was my last bite.
Thanks, Honorable Barnes. Honorable Bakubaku.
Thank you, Honorable Chairperson. Mine will start on 198 on sub-program 2.5 in the social relief. I would like to ask the following question. What are the reasons for the cuts in the expenditure for the compensation of employees, and how many posts were affected by this? My second question is on page 201 on the sub-program 3.3 childcare and protection. I would like to know what are the reasons for the cuts in the expenditure for compensation of employees, and how many posts were affected by that? And the following one was is what are the reasons for increased expenditure for minor assets, contractors, consumables, suppliers, and property payments? And the third question, Chair, is on 207 in the poverty alleviation and sustainable livelihood. My question is as follows. What was the increased budget for poverty alleviation
and sustainable livelihoods intended for. And my last question is on 208, under the table of agents and support outsourced services. What are the reasons for increased expenditure for agency and support outsourced services? And the last one is on page 211 on the administration. I would like to know what caused the delays in filling of posts and how many posts were affected. Is this a deliberate decision to cut expenditure on compensation of employees, or is it really a challenge with filling of posts? Thank you, Chair.
Thanks, Honorable Pakupaku. Honorable Van Vogel.
Thank you, Chairperson. Chairperson, mine is on page 214, current liabilities. What were these funds earmarked for and why they were not rolled over? Then on page 215, Chair, irrecoverable amounts written off. What are the details of irrecoverable amounts written off and why were they written off? Then, Chairperson, on page 231, payments for financial assets. What are the details of debts written off and why were they written off? And then the last question, Chairperson, is on page 238, fruitless and wasteful expenditure. How did it occur? Was it recovered? And what is the profile of the officials from whom this will be recovered? Thank you, Chairperson. Chair?
Oh, my apologies, I'm muted. I didn't notice. Sorry, my apologies. Thank you, Honorable Van Vogel. Honorable America. Oh, sorry, before that, Honorable America, Honorable Van Vogel, you wanted to say something?
I'm covered. Thank you, Chair.
Honorable America.
Thank you, Chair. Allow me, like my previous colleagues, congratulate the department on a
Honorable members, can you hear Honorable America?
No, Chair.
Honorable America, you are either muted or there might be some network problem in your area. Honorable America? Okay. Now it looks like we've lost Honorable America. Can we, in the meantime, then hopefully he might come back? Honorable America, just indicate when we are back. Are you back? I see he's lost completely. Can we get a response from the department in the meantime, and hopefully Honorable America will come back?
Chair, sorry, my hand was up. I'm not sure if you're going to give me a chance after the department.
Sincere apologies. Please go ahead, Honorable.
Okay. Okay,
Chair. I want us to deal with all the questions so that the department can deal with the answers.
Okay, thank you very much, Chairperson. My question is on page 212. There is an underspending on the conditional grants pertaining to the early childhood development, and the reasons given is that the NPOs were non-compliant. So my question there, Chair, is I would like to know what exactly is that, which NPOs did not comply with? And secondly, what is the department doing to assist these NPOs to make sure that there is compliance? And my last question, Chair, is on page 232. I want to understand the recovery revenue of 405,000. Why was the recovery revenue of 405,000 rand was written off? And then also, why was the other debt amounting to 755,000 written off? Those are my questions, Chair. Thank you.
Thank you, Honorable Poja and Honorable America.
Thank you, Chair. I don't know where I fell off a cliff. I don't know where that you possibly lost me.
No, I think you were still on your congratulatory notes following up.
Oh my goodness, I didn't ask the question.
We were still following up on the footstep of Honorable Baguba and Honorable Maseko in congratulating.
Sorry, Chair. Thank you for taking me back to where I was before I just was kicked off the platform. So my question relates to staff debt on page 237, Chair. And there's a considerable amount of over 2 million, 2.6 million rand owed by ex-employees. That's for leave entitlements and overpayment of salaries. And the department says in its explanatory notes that debt recovery procedures are undertaken. Can the department share with us what measures are being taken to recoup that debt, since these people are no longer part of the staff establishment? Thank you, Chair.
Thank you, Honorable America. Department.
Thank you very much, Chairperson. Beginning with Honourable Member Barnes's question about the increase in minor assets, as well as the increase in agency support and increase in consumables and increase in property payments. I will ask the CFO to respond to those. Thanks.
Yeah.
Thank you, Chair. Through you, in terms of minor assets, those are audio-visual equipment at our facilities and the refurbishments at our SDAs, our service delivery areas, and also purchases around medical equipment, thermometers, and so forth. So these are all the assets that are less than 5,000 rand, and therefore they are minor assets. Agency and outsource services. This is mainly the increase is mainly due to the reclassification, as the HOD has explained, where we dealt with it as transfers and we had to reclassify it as goods and services. And this is got to do with food relief, our EPWP, as well as our PPEs that we had to reclassify. That made the massive increase there. Consumables, supplies, these are mainly also within our facilities. And this is uniforms and clothing. And again, there it's about being full to capacity within our facilities, linen and as well as toiletries, wash, cleaning, detergents, all COVID related as well in terms of that. Property payments, this is our cleaning services, and we had to expand our contracts also to deal with some of these deep cleaning services that we had to do in the year under review. And then also security based on the PCA SPIRA rates that we also had to pay in terms of that. Thank you, Chair.
Thank you very much, CFO. In terms of the questions around the reason for the cuts in the COE on page 198 under social relief, as well as the cuts in COE under the childcare and protection on page 201, and the question about how many posts affected, I'll ask the CFO to provide inputs there as well.
Chairperson, through you, yeah, the underspend on COE is mainly due to our staff exits, and then also the slow of filling of posts, not always finding the suitable candidates, and then we also have the matter of where some of our internal promotions also happens within the department. So yeah, around all those COE underspends, it adds up to just under 1 million rand for the department. Thank you, Chair.
Thank you very much, CFO. I think the question about the number of posts, it's more to do with the number of months that a post is vacant that we end up with underspending. Because if there's a delay in filling a post, then those months that there's no one in the post, there's a saving. But there was also a period in the in level 4 and 5 lockdown where the filling of posts was put on hold for a time, and while CSC or Corporate Services Centre had to shift to remote working arrangements as well. So they were unable to process posts for a period of time as well, which did also delay some of the posts being filled. In addition to that, the question around from member Baku Foster on increased expenditure on minor assets, consumable and property payments, I think that was covered earlier by the CFO on the similar question from member Barnes. But the question around the increased budget for poverty and sustainable livelihoods on page 207, that increase was the extra funding that was brought in for expanded public works programs, if I'm not mistaken, and then also there was some increase as well for food relief and so on. So I think. But I think the bulk of it was actually around the EPWP programs, additional funding. Maybe Mr. Hill, you'd like to just confirm?
Thank you, HOD. By and large, HOD, it was for food relief, which we have explained earlier on. Only 10 million was for EPWP. Thank you, HOD. Thank
you very much, Mr. Hill. And then the question around the increased expenditure on agencies and outsourced services, I think also the CFO has spoken to that, and that was relating to the issue of the reclassification of funds that were initially goods and services, or rather transfers to goods and services, and it was placed in agencies and outsourced services, and that was for food relief. Which was NGOs were funded to provide particularly food parcels distribution during the COVID lockdown. The question again about on page 211 around the delays in filling of posts, and the question of whether this was a strategy to contain COE. The answer is no. We determined up front which posts we need to fill. So the delay in filling posts is a real challenge, and one of the biggest challenges we have is that a lot of personnel who get appointed in posts in the department are moving up from another post in the department, and it leaves a vacancy. So we never know whether we're going to fill a post with an internal candidate or an external candidate, but wherever we have internal candidates, it always results in vacancy, and then there's a lag in time where we have to then advertise that vacancy and fill that one and so on. So it's very difficult to predict an exact amount that we're going to spend on COE because of this factor. So we're given, Treasury gives us a very rigid COE ceiling that we have to adhere to, and a very specific amount that we can't shift around. and then we are trying to recruit people, and we don't know whether we're going to fill the posts. If we get no suitable candidate, we have to re-advertise, which happens quite often. And then also where we have an internal candidate, we fill the post, but then we create another vacancy, and then that has to be filled as well, and then you have savings. So that's the general pattern with COE. In terms of the question from Honourable Member Windvogel around the on page 214 on liabilities, as well as the debts written off, the irrecoverable amounts, and the fruitless and wasteful expenditure, I'll ask the CFO to speak to that briefly. Thanks.
Thank you, HOD. Through you, Chairperson. In terms of the question around the decrease in current liabilities, that decrease is mainly because of our underspend. In total, we had a 13 million rand underspend. That underspend, we have also asked for rollover, as we've already indicated as well. So that's mainly in terms of that. The write-offs, which refers to our note 6.2 in itself. So those staff debts relating to ex-employees are based on advice that we get from our state attorney, being uneconomical to recover, and in some cases we also have deceased cases, and those are the reasons why we also then have to write it off. In other cases, we also have debts due to damages and losses of our GG vehicles. In those cases, the staff members do not forfeit their right, and hence we can discipline them if they're negligent, but we cannot recover the funds, and hence we also write those debts off in terms of that. Page 231. Yeah, those are the damages and losses to the vehicles, which I've indicated. And then in terms of fruitless and wasteful, I need to indicate that the fruitless and wasteful cases, we only had 2 in our department, but those were the year before the year under review that occurred. In the year under review, we had to recover the funds. So those are officials. In the one case, they had to, they booked accommodation for a meeting, and then they did not show up. So the officials then repaid those funds. In another case, a staff member also traveled outside the province, and the person could not find the venue where the meeting was held. And that person is also now in this financial year has paid back the funds. There is one amount still outstanding of 773 rand that we are following up with the one staff member to then also pay. So that will sort out all our fruitless and wasteful, and then it will be fully recovered. As I mentioned, under the year under review, we had no new cases in terms of that. Thank you, HOD. I hope I've answered everything.
Thank you very much, CFO. Then in terms of the questions from Honourable Member Maseko, and the question of underspending on conditional grants for ECDs and on the non-compliant NPOs, and which NPOs were non-compliant and what DSD is doing to assist. I will ask Mr. Jordan to provide inputs on that.
Thank you, HOD. Yes, the non-compliance by ECDs are specifically those ones for 2 reasons. The one was where the registration has lapsed because an ECD needs to be registered every 5 years, and the Department of Social Development registered them after they comply with all municipal bylaws. And then the second reason is also for the audit financial statements. So we do various things when it comes even to the ECD sector with supporting the NGOs when they become non-compliant. We have given them extension on all their audit financial statements to see if we can assist them with that timeframes. And with the re-registration process, we actually assist them with filling in the application forms. And we also assist by communicating with the local authority where there's a struggle with regards to, say, for example, health and safety clearance or receiving an occupational certificate from the municipality. So we do assist in those kinds of matters when it comes to the non-compliance. The list of non-compliance NGOs are in the annual report. It is attached on the CD that was given out with the annual report. Thank you.
Thank you very much, Mr. Jordan. And then the question from Honourable Member Biseko about the recovery of the 405,000 written off and debt of 750,000 written off on page 232. I'll ask the CFO to assist with that, and also with Honourable Member America's question on 237 about the 2.6 million owed by ex-employees.
Thank you, HOD, through your chairperson. In terms of the debts, a similar response, chairperson, in terms of the reasons why these debts had to be written off. In the case of suppliers where the suppliers went dormant and not functioning anymore, so in that case, we then also had to consider, because of the economical some administrative issues around that. And then in terms of employees, ex-employees, we do follow a process. And that process is to write letters to the debtors, and then those responses we then follow up with them. If we do not get any responses from the debtors, we then refer this to the state attorney, and the state attorney does the debt collection process on our behalf. And that is how we also deal with ex-employees outside the department in terms of that. Thank you, Chair.
Thank you, CFO. That covers the questions from that round. Thank you, Chair.
Thank you very much, HOD. I think Chairperson is struggling to connect. Our president. You're back. Okay.
Yes. Thank you so much. Thank you so much.
Okay, over to you.
Thank you very much, Honourable Maseko. Now, Honourable, HOD, you finished with all the questions that were asked?
Yes, thank you, Chair.
Now, Honourable members, are there any follow-ups? If there are no follow-ups, okay, Honourable Van Vogel.
Mine is not a follow-up, Chair, but there's a last question that I really want to ask. It's on page 246, the incident. Yeah, can the department perhaps provide more details regarding each of the listed incidents and why there was no disciplinary actions for invalid deviation with national instructions? And why did the HOD approve this? Thank you, Chairperson.
Thank you very much, Honourable Van Vogel. Maybe also if you can just add, I don't know whether while I was cut off, was there any comment regarding the issue that was raised on the issue of the transfers to the NGOs that was given, and they embark on acquisition without following the necessary SCM procedures, as it was highlighted in the AG's briefing, or in the Auditor General's briefing notes? Maybe as to check whether what was the reason for that, if the department can just give a response on that. Was it due to the pressure of the COVID, or was it not enough time for was there not enough time for the department to have embarked on the processes of procuring the services of these NGOs? So if the department can also just respond to that, if I missed out on the explanation.
Thank you very much, Chairperson. I will ask the CFO to speak to the incidents on page 246.
Thank you, HOD, through you, Chairperson. Those incidents that relates to invalid deviation from national instructions. First of all, it is about